Hey guys, good morning. This is Dr. Carrera. I'm coming to you from Gloved Up and Scrubbed In, and I'm here presenting the 7 roots of body struggle. And it's not just about food. So I want to go forth and help you understand what we can do to possibly prevent these struggles from turning into a body or a eating disorder, and also the resources out there if somebody already is in this predicament of having an eating disorder. So let's define, to start off, what an eating disorder is. An eating disorder is a mental health condition where, unfortunately, the eating habits are driven by distressing thoughts and emotions, and it affects both their physical health and their daily life emotional health. We have common ones that everybody is very familiar with, and the main ones I will go over with you. The first one, this is rampant throughout the United States, and it is obesity. All ages. It is defined as a BMI of over 30 or higher, and it's linked to a lot of health risks. The next one is anorexia nervosa. That's a severe restriction of food intake. And most of these individuals are very consumed with gaining weight. They have a distorted body image. The third one is bulimia. This is the one Carrie, with the former podcast we were on, she had this disorder and she spoke about it, and just incredible how she was able to overcome it. This is repeated cycles of binge eating followed by purging. Behaviors also include excessive use of laxatives, because after a while they get really irritated from throwing up. They may also work out to the extreme. That goes for anorexia too, where they are just constantly doing some type of cardio. So you may see binge eating disorders where they do not throw up, and these individuals usually will do this binge eating in secrecy. So they had a fight with their parent or their boyfriend, or they're not doing well in school or at work, and they'll come home and they'll eat a whole pizza, or they hide food in drawers and closets in spaces where nobody would find it. The other is called OSFED, and this is an eating disorder. Significant distress causes, but they don't meet the full criteria for the above main eating disorder. Eating only clean, pure, or healthy foods. What do I mean by that? Have you been with someone? Of course, a lot of us like to prepare our food in the beginning of the week so that we have it and we don't make bad choices and we have high protein. And that's fantastic. That's not what I'm talking about. I'm talking about a person that can't stand to be around anything that smells fried or gluten. They avoid social events. They will order a salad, but they will make sure the chicken is only in avocado oil and not in any type of peanut oil or vegetable oil or any other type of oil. And they can't have the tomatoes in there because it causes inflammations, and the peppers make their stomach upset, and they don't want any type of dressing, but just vinegar, but put the vinegar on the side. They end up just with lettuce in their plate. So this becomes to the extreme that they isolate themselves, or again, they avoid situations of going out, or they shame other people for eating, normal foods by a slice of pizza. So I'm going to go through and discuss why things transform into eating disorders, or why actions individuals take on the role of these eating disorders. We're going to find out what's going on and why they're doing this. So obesity can start at any age. As a kid, you may be thin, and then later on in life, as you slow down, you may gain the weight, and it's contributed to a lot of different factors. But the main thing we look at is a body mass index of over 30 or higher, and it increases you for a lot of comorbidities. So the new hype, it's not even a hype, it's fantastic, but Mounjaro, Zepbound, Wegovy, and Ozempic, they have all brought some relief to individuals who have not been able to ever get their weight down, and it caused other risk factors such as sleep apnea, the diabetes, the osteoarthritis, the yeast infections, hypertension. So it's not just affecting them emotionally, but it's really taking a toll on them physically. If we go into the next one, anorexia nervosa, you will see significant weight loss with these patients, intense fear of gaining weight. They have this very distorted body image. And they almost embrace the fact and love the fact when somebody tells them that they look too skinny. It makes them feel like they have control and people are noticing. It can cause serious medical complications. When I worked at Tampa General Psychiatric Center, I would have to be face to face with the female or male, whoever was brushing their teeth. They'd have an NG tube down them and make sure they weren't gagging themselves while they were brushing their teeth and throwing up. It gets to that compulsion. It also can be over exercising, where they will compensate for if they had a half a bagel in the morning, they will go do 2 hours on the elliptical. Or if they know they're going to eat later, they'll do several hours and they'll starve themselves just to go to a social situation and have, a one piece of pizza. The next one is bulimia nervosa. And this is the repeated binge eating episodes. They compensate for just feeling shame, guilt. They just want relief, or they feel like they have this preoccupation with body shape and weight, and they want to be able to wear the half shirts and just feel good about themselves. But there is no actual weight loss with these type of patients. What happens is they just maintain their weight because they do keep the calories. It's the excess of binging that they end up purging with. This is highly recognized with patients with their teeth. Dental problems, again, Carrie explained that was kind of her wake up call when her dentist brought that to her attention. Another thing is GI issues from throwing up so much. They develop these veins in their esophagus that burst and they bleed. And I've known several patients that have ended up in the ICU and have had go in for immediate an EGD for surgery to stop that bleeding. So the orthorexia, extreme focus on food, quality, purity, avoidance of foods that are seen unhealthy, very rigid rules, restrictions. They have anxiety or guilt when the rules are broken, and definitely leads to malnutrition and social isolation. The binge eating disorder, they do not purge after this, and this is when they start to gain the weight. They may have a healthy 15, 20 pounds in them, or they may lead it to the 30 BMI. And then there's other eating disorders that kind of merge all into one. They're atypical, but a person will marry anorexia for a couple days and then binge for a couple days and then just go on a all get out of exercising for a full week. So these are common, but very overlooked and missed. So what are some signs and symptoms of any eating disorder? It's going to affect physical, emotional, and also their social health. It's a preoccupation with food. If it's overindulgence or if it's someone that's staying away, avoiding, they tend to weigh themselves a lot. If it's on the latter side of trying to be too thin, avoid social situations, the restrictive eating or rituals for patients that are anorexic or bulimic. For the anorexic, you will see scabs on their knuckles from self-induced vomiting and also fine, soft lanugo hair on the body, almost when a newborn baby is born. And you'll see that little fine hair that comes on the anorexics for malnutrition. Anorexics, there's the door frame behavior. It's them squeezing through sideways despite how wide the door's open. So the door could be wide open, but they still feel in their head they have this distorted body image that they can't fit through it. These were signs that we looked for when I worked at the psych hospital. Why do people develop these eating disorders? If it's from overeating to not taking in a morsel of food. So it could be a whole bunch of different things: genetics, trauma or stressful life events, cultural or social pressures. If your family's big, if they're always eating, if you're just migrating around the table all the time for social aspects, chronic dieting or the weight stigma of social media. I see with our kids and even younger and younger that they want to be able to wear the little itty bitty shirts and the short skirts. And I think it was a little bit of a rude awakening when Kim Kardashian did the Brazilian butt lift, I think it gave a little relief to teens and women to think, okay, I can be attractive and have a little bit of weight on my booty. So, but again, now that's kind of tending to the other way. It usually will go hand in hand to if there is some type of eating disorder. There's a co occurring mental health condition such as depression, OCD, anxiety, something else is going on. It's not just physiological, it's psychological. Let's go over the 7 roots of body struggle. So, neuroinflammation, what does that mean? Chronic stress. Okay. So, it can be at work, it can be in the family household, it could be in a relationship. And this trauma hijacks the brain. What happens? You develop cravings, compulsions, and distorted body signals, which contribute to you either wanting to overeat or undereat. So with the GLP-1s, you will hear the term food noise. So this shuts off food noise where these obesity patients feel that they hear it all the time and they have to eat. Now, the number 2 root cause would be emotional betrayal. This is whether it's binging or restriction, food becomes a proxy for safety. So these patterns often reflect broken trust. It's not broken willpower. So if you see somebody that is binging, is, obese, it's not, they don't have the willpower. It has to do with what happened, what trauma in their life occurred that is causing them to lack trust in their situation. Third is gut brain disconnect. That's the microbiome chaos. So mood swings, anxiety, and compulsive behaviors. This healing starts in the gut, not in the mirror. So they have to understand what is going on deep within and disconnect it with the brain. They have to understand why they're feeling this way, triggered the mood swing, what's going on chaotic in their life that's making them compulsive to eat or not to eat. There's a hormonal hijack. That's number 4. So you could be going through menopause, PCOS, and then your testosterone, your cortisol's all over the place, you're insulin resistant. When these misfire, your body's hunger and fullness cues collapse. You don't know which end is up. So it's not vanity, it's biochemistry. So basically, I see this a lot come through in the patient request to help them. They don't know where to go. They can't get the last 10, 15, 20 pounds off, or they've gained a significant 60 pounds and they don't know where to begin. So that's when I do a full set of labs to see if there's anything abnormal from the thyroid to the testosterone. We'll look at estradiol, progesterone, so on and so forth. Number 5 would be identity and safety. So why do you think people allow themselves to get so big and they don't seem to care to lose it? Obesity can be armor. It protects them from getting close to anybody. Somebody in their past, or maybe several people, have hurt them in the past. So this keeps people away. Anorexia, that can come from a lack of control, maybe being sexually abused when they were younger and they had no control to get out of it, or it could be a verbal abuse or someone that was physically abused to them, a relationship. So the anorexia is something that nobody can take away from them and they can control it. Bulimia is known, and Carrie talked about this, it's a release of letting all the hurt, the anger, anguish, whatever's going on, that it just is able to purge it out of their system. Each pattern is a strategy for survival. So these are symptoms. They are trying to tell you something. It's not a character flaw. There's something deep, deep within this person. What's going on? That person needs to address and actually understand that they're the only one that can change this pattern. No matter how many interventions there are, it's the person or patient is going to go right back. It's just like an alcoholic or a drug addict or somebody that smokes cigarettes. One day they're going to be like, enough is enough. Number 6 is perfectionism and control. So again, going back to anorexia, this often emerges from a need to feel enough in a chaotic world. Not pretty enough, not skinny enough, control. That restriction becomes a ritual, and thinness becomes a proof that they can stick with something, proof that they have control, proof that they can triumph. It's not a triumph, it's a trap because you can't get out of it and it ruins you from the inside out. your organs, you lose your hair, it's a horrible way to watch somebody go through this because they're unfortunately leading to their death. Number 7 is shame and secrecy. So bulimia or these overeating, binging patterns, they are always in silence. They thrive in silence. They will keep it quiet. They don't let anybody know. The binge purge cycle is often fueled by shame. Again, it's in secrecy and it's just feeling emotionally overwhelmed. So, for someone that is going through this, there is a way out. And it could be going through therapy, it could be matching it maybe with antidepressive. Lillian Ingram, who is the founder and also nurse practitioner of Learning to Achieve Wellness, has incredible providers on staff. And also, she has licensed therapists for 11 different clinics that are available to talk with you or someone if they are facing this challenge, this crisis. We do the screenings, the PHQ-9s, the EDQ, the COFF. These are all overlapping for both eating disorders, depression. They have the anxiety scale also. We look at the BMI, the weight history. If you come to me with the obesity, this is the one that I'm specializing in. I will do a set of labs. We'll do your hormones. We'll look at vitamin deficiencies. We'll look for the culprit. So, mini psychological evaluation tests that I will do just to make sure, we're on the right track and see your support system, who's around you, and where your mindset is. Treatment approaches are therapy, the CBT, the family therapy, and the exercise if you are obese, not extra for anorexia or even bulimia. Nutrition counseling. A lot of, believe it or not, the bulimics and anorexics are very well aware of macros and calories and everything like this. The nutrition counseling is more geared toward obesity so they can sustain eating habits and they do not just eat out of habitual. If it's nighttime in front of the TV, they're not grabbing popcorn all the time or just the standard 3 meals that they have to eat. If you're not hungry, don't eat. We may need to marry medications with that for mood, anxiety, appetite regulation. For obese, the GLP-1s are fantastic. It goes further. Then, of course, I'll refer you to a specialist for psych to see for it so that you have support, the social support. This encourages connection, accountability, someone you could talk to that might have been in the same situation as you and can give you some great insight. Again, talking about the GLP-1s for obesity and emotional eating helps improve blood sugar, digestion, and gets rid of a lot of the comorbidities that come along with obesity. There's the NAD. This is the nicotinamide adenine dinucleotide. This is great for brain health and increases metabolism and DNA repair, fatigue, mental clarity, resilience, chronic fatigue, burnout. I try and couple this with my obese patients or patients that are overweight that are just tired. Or if you're at a great weight, but you're in school or you have a very busy life with kids, this is fantastic to repair DNA and then also increase your energy and then cognitive clarity. Fantastic. Amlexanox is fantastic. This is anti-inflammatory, immune modulating agent. It helps reduce inflammation, but it also helps you lose weight because it increases your metabolic function and it improves insulin sensitivity. So if you want to not take an injection, this is for patients that don't want to do an injection once a week, but rather would try something by mouth. These are great. When to seek help. Now, today, don't wait. And when you're absolutely sure this is it, I want to do it, let's go. So if you know that you're having a loss of control, you're losing some meals, binging, purging, using laxatives, you just feel so weak. If you listen to, everybody knows Taylor Swift, and if you listen to her documentary on the Netflix channel, she talks about that she had an eating disorder and she was on the anorexic side and just felt that she needed to be so thin. She would get on stage and barely have the energy to go through her full set because she thought she was supposed to look a certain way. And she talks about how she's overcome that now and she's healthy. But even somebody like Taylor Swift, who everybody idolizes, can have a hidden secret. So you are not alone. Support and resources, you can go to yourvipdoctor.com. It's my career telehealth and wellness. There's the NAMI helpline, the 1-800-950-6264. There's counseling in Florida with Lillian Ingram, Learning to Achieve Wellness. And then there's Life Coach with George Martinez. You got this, guys. If you have any questions, we are here. Recovery is possible, and every step forward matters. Here are some testimonials you can look through. I'm not going to go through each one in detail, but these are just fantastic. These are patients of mine that have tried everything from medications, phentermine, Beachbody, calorie counting, macros, little success, and using GLP-1s. They totally transformed their body, and then they went forward and took care of their mental health. Here's one that all she says is the best way I can describe the feeling is freedom. So she had binge eating problems. She started at 240 pounds and she got down into the 130s. Another one, 262 pounds. She's down to 155 pounds after 9 months. That's a lot of weight in a short amount of time. But again, her words were freedom. Here's one of my favorites. This gentleman, handsome gentleman, busy career, kids, and he gained a knowledge of understanding what healthy living is again. And he lost a ton of weight too. Thank you for listening. If you guys have any questions or if you want to transform yourself, start today, just want to talk, you can go to yourvipdoctor.com and we, myself, my staff, we're there. Just tap on Get Started here. Okay. Have a great rest of your week. Thank you guys. Talk to you soon. Bye-bye.